In today's episode of Pinoy Nurse Portal, we will talk about the proper handoff/report. And what is that, Nurse Rebecca? Handoff or report is another word for endorsement. In the United States, we no longer use the word endorsement. I know if you are from the Philippines, that's the term we use when we give report to the incoming nurse. So in today's episode of Pinoy Nurse Portal, Nurse Rebecca will show you the proper way to give report the USRN way. So if you're interested, please stick around. To start today's episode of Pinoy Nurse Portal, let's start by reading a case study of this poor 58-year-old woman. This is not from our hospital. This is from Missouri Medicine. Okay, so I will read the case study to you guys. We will read it together. I will put it here, okay, because we will use her case study to give report. Okay, so let me read it to you. This is a 58-year-old female patient was activated as level 1 trauma alert after being involved in a house explosion with resultant fire. She was awake and alert with no loss of consciousness at the scene, but sustained significant thermal injuries per EMS report. She was intubated pre-hospital for airway protection out of concern of inhalation injury with facial burns. Initial evaluation revealed an older woman orally intubated with bilateral breath sounds, mildly tachycardic in the 100s, moderately hypertensive in the 160s over 90s, with readily apparent full thickness burns to the face, neck, anterior torso, bilateral arms, and bilateral legs. Okay, so that's the case of the patient, and let's pretend she also has a wound in her sacrum, okay? Just because I want her to have burn in the sacrum, we will use her as an example in giving report. Now, looking at her case, it looks like this patient, not looks like, I'm sure she needs to be in the ICU. Now, your nurse, Rebecca, is no longer an ICU nurse. So let's change the scenario. Let's say this patient has been in the ICU for 2 weeks. She is now ready to go to our regular floor. And by the way, guys, regular floors are divided into a med-surg floor and a tele floor. So what's the difference? I know in the Philippines, wala tayong tele floor dyan. We only have med-surg or ICU. Let me know if we now have a tele floor in the Philippines or in your country, wherever you are in the world, okay? So telefloor in the United States, meaning the patient has cardiac issues and they have to be cardiacally, or they have to be monitored. They have to be connected to a tele monitor. Okay, it looks like this. This is the portable tele pack. Okay, so some hospitals will have a 4-lead tele, some hospitals will have 5-lead tele, depending on the leads they use. Your nursing responsibility when you receive the patient is to check whether the leads are in the right spot in the patient's chest, okay? Or make sure that it is connected to the patient. True story. Okay, just shortly, I got a report that the patient is on telepack. Okay, this is at the beginning of the shift. When I was about to pick up my phone, I saw a telepack with my patient's name on it. The order was written at 4 o'clock. Okay, since I'm a responsible nurse and the nurse who gave me a report is slightly not responsible nurse, I took the telepack and put it to my patient's chest. Lo and behold, the patient was having ACS, okay? The patient was asymptomatic. He was not having chest pain or anything like that. That's why it's really important that when you get a tele order for a patient is to make sure to connect it immediately because some patients are asymptomatic. Medyo na segue na tayo, but that is a really important nursing responsibility if the patient is on a tele monitor. And yes, you need an order for that. So now let's proceed to giving a handoff or a report to the incoming nurse the USRN way. So start by telling the name of the patient, the age, the date of admission, the diagnosis of the patient, the code status of the patient, whether he is full code, whether the patient wants to be DNR or DNI. That's very important. Allergies. It's really important that you know the allergies of the patient. If the incoming nurse will not mention it and you are the incoming nurse, it's important to ask, does the patient have allergies? If it was never mentioned, make sure that you will look on the chart of the patient. Okay, next, past medical history. It's really important that you mention that. And I am showing you the order of giving report and receiving report. This is how a report, an effective USRN report, should sound and look like. If I am missing anything, please comment down below. Okay, next, the diagnosis of the patient. So our patient, let's say the patient has 20% burn. Her diagnosis is 20% TBSA on the face, chest, bilateral uppers, both lowers, and the buttocks. The patient's neurologic status. Is the patient awake and oriented? If the patient is oriented, is it times 1, times 2, times 3, times 4? What are those? Is the patient oriented to place, time, and person? And what's the fourth one? Starts with letter S. Comment down below. Correct. Situation. Does the patient know kung bakit siya in the hospital? You could ask the patient, do you know why you're in the hospital? And the patient, especially for ETOH patients, they will tell you things that are funny, but don't laugh at your patient. Okay, so neurologic status of the patient. Next, respiratory. Is the patient room air? Does the patient require oxygen? Does the patient require CPAP, BiPAP at night? If the patient needs CPAP or BiPAP at night, does she have it at bedside? It's also important that after receiving report to do the nursing rounds. Okay, make sure that everything the nurse gave you on that report is present at bedside. For example, the nurse told you the patient is on wound vac. Where's the wound vac? Or the patient has wound vac, but make sure that the wound vac has a plug, okay, and it is plugged to the wall. Okay, next after respiratory is cardiac. Like I said, is the patient on tele? If the patient is not on tele, just tell the patient is not on tele. Okay, don't worry, I will give you an example at the end. We're just discussing the structure right now. Next, the skin. We already know that the patient has burns on both uppers and somewhere else in the body. Okay, so what else do you want to know about the burns of this patient? You want to know the type of what? Yes, the dressing that the patient is on. It is your responsibility to know the type of dressing of your patient. Okay, you cannot tell the incoming nurse that you don't know. I don't know the dressing of the patient. I did not do the dressing. Girl, do you know the past medical history of your patient? Yes, you know. You have to also know the burn and the dressing of your patient. You have to know that. Okay, okay, next, GI. This is where you will mention the diet of the patient. Does the patient has NG? Does the patient has a duotube? Sometimes the patient will have both, a duotube and an NG. The duotube for feeding if they need to be fed, and the NG for decompression. Okay, so next thing you need to report with regards to GI and the tube feed is the patient tolerating the tube feed? What does this mean? It means that wala silang residual, or if they have residual, what is the acceptable residual? In our hospital, now it depends on your protocol. Again, you will hear me say this over and over again. Check the policies and protocol. Sa hospital namin, it has to be 200 and over. Anything less than 200, you can still feed the patient, okay? Again, that's for burn patients. It depends on your hospital protocol. Next is GU. Okay, what do you want to know? Is the patient self? What does that mean? It means that the patient can help herself to go to the bathroom. Is the patient using a urinal? If you have an order for strict I's and O's, it's important that the I's and O's is really strict. Okay, so give your patients in the United States, we have both male and female urinals. Okay, female urinals look like this. Male urinals look like that. So how can you tell the difference? Remember, girls have curves, and so is our urinal. Okay, so GU, you need to give report. Does the patient has nephrostomy tube, Foley cat? Is the patient on pure wake? What is pure wake? Pure wake is this one. Okay, if male patients have condom cap, for female patients they have pure wake. This is how it looks over here. Okay, this is a flexible tube. This blue thing over here is your nursing responsibility, that when you put it in, not in, when you put it on the patient, let's say this is the buttocks of the patient. Okay, so dito yung GU niya, dito yung buttocks. Make sure that this blue thing is really inserted underneath. By the law of gravity, the urine will not go up. Although this is connected to the wall suction, it's still important that you insert it all the way back. That way, when the patient pees and it flows backward, this blue thing, okay, or the pure wake will suck it. It's connected to a wall suction. Okay, nursing responsibility. If the patient has pure wake, check the area. Q shift, okay, or as often as possible. And we change this Q 24 hours. Again, check the protocol and policy of your hospital on how often you're supposed to change the pure wake of the patient. Next, is the patient on AccuCheck? Is it ACHS or Q6 hours? For patients that are NPO, AccuChecks are usually ordered Q6 hours because they are not eating on their own. They usually have a tube feed running or IV fluids. Let's say, for example, your patient previously was NPO and her or his AccuCheck was ordered Q6. Now the patient now started eating. She now is eating 3 times a day. What's your nursing responsibility? It's your nursing responsibility to ask the doctor, hey doctor, the patient is no longer on NPO. She started eating today, but her AccuCheck is still Q6. Do you want to do it ACHS? The doctor will usually say, yes, yeah, let's do it ACHS, okay? Next, LDAs. What is LDA? Lines, drains, and airways. In the ICU, they have a lot of LDAs. In the regular floor, they will probably have a PICC line. What is a PICC line? PICC line stands for peripherally inserted central catheter, central line catheter, okay? The PICC line nurse will insert this, and it's usually on the brachial area, right or left. It depends, okay? Does the patient has central line? Does the patient has IV? Lahat ng nakakonect sa patient. Ano bang tawag sa Philippines? In the Philippines, we call it contraptions. What are the contraptions? Anything that's connected to the patient. Ano pa? What else should be included in the LDA? Does the patient have a wound vac? Nursing responsibility, if you have a wound vac, make sure that before giving report that you mark the output and make sure that you have the plug system. If you are the receiving nurse, especially if you got report from OR, the patient post-op, usually they bring the patient with wound vac, but there is no plug. Hey, call them, hey, you didn't bring the plug back in. Your wound vac will die if you don't have a plug. Usually it will beep in the middle of the night. Why is it beeping? Yung pala, the battery is about to die, okay? What else? Next, the social issues of the patient. Social issues, for example, for kids, we call CPS, Child Protective Services. If you suspect abuse with your patient, it is your nursing responsibility to tell your charge nurse or call CPS for kids and Adult Protective Services for adults. Just Google the number, and usually you will have these numbers written in your phone book in your hospital. Never ever ignore signs of abuse with your patients, okay? If you did not report it that your patient was actually abused, that's neglect in your part as a nurse, okay? But let's say, for example, there was no abuse, okay? So CPS or APS came over and investigated the case, but there was no abuse. They will not take it against you. You just did your part as a nurse, okay? Next social issues is the patient NINP. I already talked about this in my previous video with this thumbnail over here, and link will be in the description down below, but I will talk about it again. NINP stands for no information, no publication. Your nursing responsibility is to not give any information to anybody not involved in the patient's care, okay? Next, consults. Let's say, for example, the patient has nephro in the case, cardiologist in the case, hand surgery in the case management, psych. You will meet a lot of patients that has psych issues, and psych might be on the case, psych might not be in the case, but if the patient has like psych medications, usually psych will be involved in the care of the patient, okay? Okay, so there you have it. That's the structure of giving report to the incoming nurse, okay? And that's the structure as an incoming nurse to expect when you are receiving report. Now, using our case of this 58-year-old burn patient, we will do our handoff. Okay, so this is how I will do my handoff based on this case study and based on the structure that we just talked about. All right, this is Jane Doe, 58-year-old female, admitted on January 12, 2023 for 25% TBSA. TBSA stands for total body surface area. 25% TBSA burn on the face, the chest, both uppers, both lowers, and the back. She was previously intubated upon admission, was extubated on January 17. She is full code. That's the code status. She's allergic to Motrin. She has past medical history of AFib, CABID, diabetes, bipolar, ETOH, polysubstance abuse. She is NINP. The code is 000. She has a POA. Her name is Cynthia. She is a friend. Her number is 623-222-222-222. Okay? So what is POA? You will meet patients that will have a POA. POA is power of attorney. These are the designated human being, designated someone who can decide for the patient, okay? And don't worry about it as your nursing responsibility lang. For example, the patient needs consent. You have to call the POA of the patient to consent for the patient, okay? During registration, upon admission, registration will get the POA and the paperwork for the POA of the patient. Make sure lang that if you are using electronic chart, that the POA is scanned on the patient's chart. If you are still using paper charting, that it should be on the physical chart of the patient, okay? Okay, now let's continue. The face is open to air with aquaphor. Both upper extremities and both lowers are on zero form and bacitracin. The chest has spots with AGSD. The butt is status post autograph pause of day 2. It has a wound vac at 125 medium continuous. The patient is awake oriented ×3, sometimes confused to situation, but she is redirectable. Okay, she is at room A right now. She desats when she sleeps. She needs 2 to 3 liters oxygen at night per nasal cannula. She is tele. She is normal sinus rhythm right now. She is turning Q2 with pillows. She is on a specialty bed with overhead trapeze. Ang daming report. I'm just giving you a good example right now. Okay? She passed the swallow eval. She can now have a mechanical soft diet. She still has a duo tube though at 95 centimeters. It's bridled. What is bridled? This is a really cute device. Okay, it holds your duo tube in place. This is how it looks over here. Ayan siya. It's hard to kabit. For some reason, I tried 10 times already in my lifetime as a nurse in the United States, and I've only been successful twice. We all have our own strengths and weaknesses. My strength is IV, okay? They call me the IV whisperer on our floor. But bridal, always mostly unsuccessful. Next, okay. Let's continue. Ulitin lang natin yung sa mechanical soft. Okay, she is now on mechanical soft diet with duo tube at 95 centimeters. It's bridled. It's on the right there. She is getting Glucerna 50 cc's an hour from 6 p.m. to 6 a.m. I started it for you already. And she has no residual. She is tolerating it. She still has a FLEXI seal with good output. Okay, nursing responsibility. And again, you have to check your hospital protocol regarding FLEXI seal. What is FLEXI seal? I have a separate vlog about FLEXI seal, okay? Next, she has a Foley cat with good urine output. How do you know the patient has a good urine output? What's the standard? Anong calculation? Comment down below. Next is LDA. What is LDA? Stands for lines, drains, and airway. So this patient has a PICC line on the right upper arm. It's double lumen. So what do you want to tell the incoming nurse? Aside from the PICC line being a double lumen, you also want to make sure that the PICC line is drawing blood, okay? If the one of the lines is clogged, do not force it. Get an order for alteplase or cut flow. Anything else that I failed to mention? Any consults is also important. Let's say, for example, the patient has a nephrology consult, case management consult. especially if the patient has a lot of complications during the stay, you will see a lot of consult. Okay, in the Philippines we use the word referrals. The patient has referral to cardiologists. Over here, instead of the word referral, they use the word consult. And there you have it, guys. Thank you so much for watching today's episode of Pinoy Nurse Portal. If you are a USRN and you are watching this, please comment down below on the things that I missed, because I believe that sharing is caring. And if you are not a USRN yet and you are about to become one, please comment down below. I'd like to know where you are in your application process. And let me know if you're planning to become a burn nurse or if you're planning to come to Arizona. Thank you so much for watching. Once again, this is your nurse Rebecca for Pinoy Nurse Portal. And guys, if you're not a subscriber yet, please don't forget to subscribe and follow me on my socials, okay? See you on our next vlog.